Statin gaslighting video number 4 refers to the risk of diabetes with statins. Hi, if you're new to my channel, my name's Brian. I practiced medicine for 30 years and left in 2017 to become a health coach. The medical industrial complex no longer made sense to me. We are looking at 8 common myths and misconceptions according to a doctor on another platform in the use of statins. Number 4, his myth is statins cause diabetes. And what he calls fact is that statins cause a small increase in the risk of diabetes, mainly in patients who are already at high risk for diabetes. So let's look at that. In fact, your blood sugar levels may increase while you're taking a statin. And that side effect was important enough for a 3-letter agency to put a warning label on statins regarding the risk of blood sugar elevation in 2012. Over 100 million Americans have difficulties with insulin, meaning chronic elevation of insulin, insulin resistance, prediabetes, and metabolic syndrome, as well as fatty liver disease, putting them at high risk for type 2 diabetes. In 2023, the Cleveland Clinic did a review paper on the risk of diabetes with statin use and quoted a meta-analysis of 13 studies showing a higher risk of diabetes for every statin except lovastatin. Reporting on 153,000 postmenopausal women who at baseline had no diabetes in the Women's Health Initiative, that study found that 71% of those patients developed type 2 diabetes after using statins. A 2015 study looked at patients who were having acute coronary syndrome and underwent percutaneous intervention, so think balloon angioplasty or stent, and the hazard ratio of developing type 2 diabetes in statin users was 1.27, meaning the risk of developing type 2 diabetes was 27% higher in statin users. The highest was pravastatin, which was at 71% higher risk of diabetes. And to be fair, in that study, lovastatin users had a 13% reduced risk of type 2 diabetes. Doctors that promote statins frequently quote the relative risk reduction of about 29% for developing cardiovascular disease if you take a statin. So that's considered a wonder drug, but a 27% increased risk of type 2 diabetes with statin users is considered small and insignificant. So which is it? The absolute risk reduction of stroke and heart attack major events with statin use is less than 1% at 5 years of use. And then they quit studying and following those people most of the time. Considering that type 2 diabetes is a major risk factor for cardiovascular disease, the leading cause of death in the US, I would think increasing your risk of developing that by 27% for a less than 1% reduction in major cardiovascular events doesn't add up. So make it make sense to me. Have a great day, and I'll be back with gaslighting number 5 tomorrow. Talk to you later. Bye.